if we have this first layer and we draw this first layer, we have in all this area the flexor Digitorum superficialis and profundus. So from this point is going to be tendon. So mainly the muscle belly is here. So usually we are going to find in this area. It can be a bit more medial or lateral, also depending the finger. So what we usually do, and especially in neuro patients, is that in this position we ask the patient to relax if possible. Okay, we just move. So I put my fingers or covering this area, and I try to do small movements but very fast, like this. Okay, so for example, I try to feel if there is any vector with a bit of more tension or activity. Okay, so here it's very difficult, but for example here I feel something in this area. Okay, so you can move very fast like this. Perhaps here. Anyway, what I can do with orthopedic patient is to check if I feel a bit more tension here, that I feel it. Okay, so I'm going to do it a bit of here. Which is the problem also here? We can find the median nerve. Okay, so we will go again checking if everything is okay. So, which is the needle length we are going to use here? What do you think, more or less? 40 at least, or sometimes even more. Okay, because in this patient, if you realize, I cannot flatten the tissue very much. Okay, so more or less, if I'm perpendicular, I think that with 4 centimeters I will have reached the ulna very well. Okay, but I'm not 100% sure, so we can try with a 4 centimeters. Una de 4. No, que había, no. No, give me, this is very thin, it's going to bend, so we wait for... Yeah, because the 4 centimeters needle, we have different calibers. 0.25, which is good for the 25 millimeters, but for this is going to bend a lot, okay? So I don't usually choose that. So remember, we have insertion, muscle belly, tendon, so I'm going to do this mainly here. So for example here, if I feel a bit more activity, I can place it here, 1, 2, 3, and I'm going to ask the patient if he feels any electrical feeling, any strange feeling, okay? I haven't reached the ulna, I'm almost inserting all the needles, so well, I cannot be sure that I will be taking all the muscle, so I would have needed a longer needle, okay? Or perhaps this is very central, I'm in the membrane, so I'm going to change a little. Now, yeah, have you seen the twitch? Have you felt electricity or not?
I felt electricity.
Electricity or twitch?
Yeah, I felt a small twitch, but with electricity.
Well, so sometimes when the patient says that, you have that, if this is electricity, this is a local twitch because the twitch was very clear, but sometimes the twitch is a bit electrical. Did you feel the electricity until here?
Yeah.
Okay, I'm going to change a little the direction. Is it fine?
Yeah, that's okay.
Do you feel twitch there?
Yeah, I felt up.
No? Twitch?
Yeah, it's twitch.
Only twitch?
Only twitch.
Okay. Okay, so more or less, have you seen the twitches? So the only thing is that sometimes you cannot be 100% sure because the patient sometimes you are physios, but the patient sometimes this is electrical and sometimes this is because of the twitch. Okay, so anyway, we have got some twitches. There is a bit of bleeding. It was the needle very painful or not?
No, just.
Okay, so sometimes if the patient complains of the needle, this can be due to a blood pressure.